Okay, I'd like to call the Thursday, August 4th, 2022 Health Committee meeting to order. We have 6 members present, so we have a quorum. We have minutes from June 16th, our special meeting. Have a motion. Motion by Beer, second by Chung. Any additions or corrections? All in favor? Aye. Any opposed? Okay, and the minutes have been approved. Do we have any members of the public?
We do not.
Thank you. Under departmental matters, the first thing I want to have County Administrator, I can't talk today, Taylor, talk about jail medical.
Yes.
Thank you.
Thank you, Chair Schaefer. So in your packet, you will notice that we do not have a departmental category for jail medical on this month's report. We are going through our transition period with ACH. They took over mid-year, or excuse me, well, it is kind of mid-year, but it was mid-month in July. And so they are prepared to provide our statistical reports in August. And in August at the September meeting. And we will have representation from the jail also provide a report on any matters that they feel relevant. In the past, jail medical was supervised by administration, but with this being a contracted company that will need oversight from jail staff, it will be more of a collaboration and connection with the jail administration, and that would be Diane Hughes, Ovid Winans, and Matt Proctor that will be intersecting with them.
Thank you. Then moving on, first up is Jason Tabb, Juvenile Detention.
Good evening.
Hi.
You
have your
have my
report.
report. I'd be happy to answer any questions.
Anyone have any questions for Mr. Tabb? Okay, thank you.
Thank you.
Next is Tim Wiley, Nursing Home Administrator.
Hello.
Hi. We have your report too.
Yes.
Is there anything you'd like to highlight on your report?
Actually, just to bring up some fresh news, hot off the press, we actually today hit the highest Medicare census that we've had since, well, I think Brooke has been director of rehab at the home for a couple years, and we're actually at 16 Medicare, and that's the highest number since I've been there, and Brooke says the highest number since she's been there, and we have more coming. So we're excited about that. And then another little highlight from a staffing standpoint, since June 26th, I think with the 3 that we hired today, we've hired 16 CNAs since June 26th. Nurses are still very hard to come by, but the new legislation regulating agencies has made a difference for our CNA recruitment. We've had agency CNAs who really enjoyed working at McLean County, and when they found out there was no more non-compete and they started watching their hours fly away because we were hiring new people, they wanted to continue to work there, and I think that speaks well for our nurse management team and for the county that it was the work environment that closed the deal with the CNAs.
That's awesome news. Plus, in addition with the Medicaid reimbursement rate going up, it's really going to, I think those things are going to help our
Yes.
bottom line a lot. So I think that that's really good positive movement
Yes.
with the Medicare, additions. So
And the highlight from the report, historically in this industry, June is a bit of a plateau month. And our census remained steady in the 90s, but we've already seen growth in July and in the first few days of August, so we're trending out of that pretty well.
Anyone have questions? Member Metzger.
I just wanted to acknowledge, I think it is in your first section, customer service and census growth. Under D, 52%, local hospitals are accounting for 52% of our referrals. I think that is pretty significant because in the past, we were not getting those. So I think that is another feather in the hat of you and your staff. Also, one thing that I think that is pretty positive is also E, and that is the hospice unit. I think most people don't understand what hospice really means and how difficult it is on families, and to have an opportunity to have someone help you through that whole situation is positive. So to have, that you've served 20 families is another very positive thing. I do have one question, and it talked about your utilization was 57% in June, but that will reduce with the 16, I would assume. Is that correct?
Yes, that is correct. And during the part of that utilization increase was we were transitioning a new scheduler in, and so we had people managing the nurse schedules, and I had to address some and put some controls in place. So it did spike. Already for the month of July, our utilization is already down to 45%, possibly 44%. I have one more week of data that I need to be able to have a firm number on that, but we have it back down under control, and it's going to continue to go down with the agency, the CNA utilization. Yeah.
Very good. In that same section, D, I don't understand what Medicare provider tax is. Can you help me understand that? I understand that our Medicare reimbursement is going up, but I was not familiar with this Medicare provider tax. So how does that impact us?
We have a occupied bed tax that that all facilities pay monthly, and then it's $6.07 per bed per day that's utilized, minus the Medicare occupied beds. Without dragging into the weeds, there's just a $6.07 occupied bed tax that's paid monthly, and then there was a quarterly tax that I want to think was $1.50, and they've raised the monthly bed tax to $19.20. But the last report that I got from my consultant, Larry, that you folks so graciously approved, and he's going to be a huge asset, he thinks that the quarterly tax will go away. But it didn't surprise me. We're raising your daily reimbursement, and now we're going to raise your bed tax.
So then we'll have to just watch that, right?
Yeah,
And there's nothing we can do, I understand, but
That
it'll
is-
be interesting to see the impact of that.
I have a feeling that the lobby organizations, Illinois Healthcare, Leading Age Illinois, are keeping a close eye on that as well.
Okay, and one last thing, and it is, again, a question in your report on page 7, you have average M2, that's Medicare 2, is that correct?
So M2 is my own terminology. It's for Med-A, Medicare A, and
Okay.
like Medicare. So, or managed Medicare. So it would be people who are on traditional Medicare or people who have taken out Medicare replacement policies. And they both reimburse about the same.
And so when you go to the far right side, that last column,
Correct.
you have the census, so I understand that. And then MT2 peak, so why, just because the higher that MT2 is, the more reimbursement we're going to see? Is that what you're trying to identify here?
So what I like, the reason I include the peak column for my own tracking and then for reporting is sometimes the average census for the month might look okay, but I like to highlight, like for instance, in April, we hit 101. And our Medicare and managed care, our short-term rehab in January average, or hit 12. Well, now for August, we'll be able to say it hit 16. I just like showing where our peaks are growing as well. Because within a month, even if we just have 14 days at a high Medicare number, that results in tens of thousands of dollars just for that month. So that's why I included that information of where our total census peaked and where our short-term rehab, our Medicare census peaked for that month.
Very good. Thank you so much for that explanation.
I think that that's something that people don't understand, that Medicare a lot of times is a very short-term stay, and it's not like a long-term care that some of the other individuals in the facility have, so.
And our average length of stay is around 35 days, which that's a really solid number in this day and age of quick turnaround. But it's a little higher than some medical providers would like, but we refuse to send people home too soon.
Anybody else have any other questions? Okay, thank you.
Thank you.
Next is Jessica McKnight, Health Department Administrator.
Hello.
Hey, you have an item for action, request approval of an ordinance of the McLean County Board amending the 2022 Combined Appropriation and Budget Ordinance for Fund 107. Do I have a motion? Motion by Chung, second by Martin. If you'd like to explain that?
Sure. As noted in my memo in the packet, this is moving monies from one line item to another. So based on the changing landscape of COVID-19, we are not currently doing large mass vaccination clinics. So we're not needing the contractual personnel that we were looking to use this money for. So we are instead using this money to cover some of our staff that are still working with COVID-19 vaccinations. So just a payroll redistribution and moving that monies from contractual to payroll and fringe.
Any questions? Member Bell.
Now we have monkeypox. Is it a good idea for us to start rolling back, putting monies in other funds? The president's supposed to declare state of emergency. Our governor has done that already. I'm just looking down the future of the next couple of months.
I'm not sure I understand the question, but this is specifically COVID-19 vaccination. So monkeypox, we can't necessarily use a lot of our funds for COVID-19 on monkeypox. Not to say that there won't be additional funds for those, but this is for COVID-19. Does that answer?
Yeah, I
Okay.
understand, but we're getting ready to go through another, I don't even want to think about it, okay? Thank you for clarifying that this is for, that's for, okay? And it stops there, okay, thank you.
Anyone else? All those in favor? Aye. Any opposed? Okay, and that has been approved. You have your monthly report first. And does anybody, if there's anything you want to highlight on your monthly report?
Just highlighting, obviously, bringing up monkeypox. I know that it is in the news and out there, and we are getting questions about specifically vaccines. And as I noted in my report, local health departments are unable to request monkeypox vaccine until they have a confirmed case. So Right now, we have not had a confirmed case of monkeypox in McLean County, so we're not able to request vaccine at this time, but we are starting, conversations with our healthcare partners to prepare for if and when we do have a case and if and when we get vaccine targeting our, most vulnerable populations.
Would the health department be the contact vaccination place for that if that should arise? Or would that be then, I think maybe this is what Member Bell was maybe kind of getting at too, is would it be distributed to providers, our health partners, to do those vaccines?
Yeah, we're looking at it similarly to how we did for COVID-19 vaccine. So looking to our partners that would be willing to distribute and administer, and again, help us reach populations that are at highest risk. So I think it would be, just like COVID, a mix between us administering vaccines and also looking into our partners. And so, but the vaccine would still at this time come through the local health department, similarly to how it did for health department for COVID-19. We receive it and then distribute it to partners.
Thank you. Any other questions on that? Remember? Okay. On her general report? Yeah, on her general report. Go ahead.
I've just noticed that, and if you can't answer this, you can certainly just have somebody send me an email. And that is, we're seeing a significant rise in the number of food permits this year, it looks like, versus last year. So we're seeing a rise in that. Are there just a lot more establishments or pop-up establishments? Or if you don't know that, I totally understand, because that's maybe not your wheelhouse right now. So
I know one difference from this time last year to this time this year is COVID-19, and so we did have some facilities that weren't open and operating, so didn't renew their permits at that time, but now things have started opening up, and places are renewing their permits because they're open.
okay. So it's really the reduction in 21 versus an increase in 22. Thank you.
Any other questions on our general report? Okay. And then you have another item for information on the grant-funded required position on pages 36 through 42. Did you want to say anything about that? I assume that this went through finance yesterday and passed, but there's just information for us. So if you want to maybe say something about that.
If there's any questions, I can answer, but this is for a grant-funded position in All Our Kids or AOK network grant. So it was a new requirement of the grant this year, and so we're adding the position according to the grant requirement, and don't know obviously if that will be continued in future, but the AOK grant is one that we have had for quite a few years.
Any questions? Member Chung?
I thought about another question I forgot to ask. Is that okay if I ask them? I know that, wait, what are we? We're in August. So just last month, the 988 number had I don't know if, are you guys doing any sort of messaging with that? Is that anything to do with the health department? I'm just wondering. Or if you know of how it's going, or if you know anything about that. Okay.
Don't know really how it's going, other than, we are doing a little bit of messaging and requested some materials to help promote, just mainly with our clients and just to the public, but not really in charge of the promotion.
Anybody have any other questions? Okay, thank you.
Thank you.
Next is Ms. Cassie Taylor, County Administrator.
And I have no items for action this evening, and I do not have any further information to present.
Okay. Is there any other business or communication other than our next meeting is September 1st? Okay. If not, we have bills to pay. Our fun time of the meeting. Is that what we're going to do? We're going to do 1, 2, 1, 2, 1, 2. Okay. The auditor has reviewed the bills, and they comply with all of our policies or ordinances and resolutions. So first, we have the Developmental Disability Board with a prepaid total of $73,087.45. Motion by Martin, second by Metzger. All in favor? Any opposed? Okay. Jail and JDC Medical have a prepaid total of $31,102.30. Motion by Metzger, second by Chung. All in favor? Any opposed? Okay. Nursing home has a prepaid total of $173,523.45. Motion by Chung, second by Beer. All in favor? Any opposed? Okay. And the Board of Health has a prepaid total of $260,916.79. Motion by Beer, second by Bell. All in favor? Aye. Any opposed? And with that, we are adjourned. Thank you all.